Everyone, my name is SHIFA ANAS. I am Assistant Professor in Department of Biotechnology, KIT College. Today I am going to take a general topic, that is on first aid. First aid is the initial assistance you give to a person who had an accidental injury or has some illness. So what are the guiding principles of first aid? The guiding principles of first aid are prevent, preserve and promote. What does this mean? Prevent further injury, preserve life and promote for recovery. Then we see the action plan for first aid. What are the action plan for first aid? First is D, second is R, then A, B, C. And it is as follows: danger, response, airway, breathing and circulation. So what is meant by all this means? Danger, you have to see if that person is in danger, or are you going to be in danger if you approach that person, or if others are going to be in danger. This kind of situation happens in natural calamities like earthquake, tsunami, etc. You have to see the area, you have to see whether it's safe to approach that person. Next is response. After you reach that victim or casualty, you have to see for his or her response, whether that person is conscious or not. First is you have to check the person's airway, whether its airway is free to breathe, take oxygen, and if something is stuck, you have to do the following procedures for the person to breathe. You first, what do you do, as in you keep a hand in that person's forehead and take another hand and keep two fingers on their chin and lift that person's head and open their mouth, tilt and open their mouth. Next is you have to check for breathing, whether that person is breathing or not. You see breathing by three ways. First you have to see it, then feel it, then hear it. First is you see the rising and lowering of the chest, that is the first sign of breathing. Second is you hear whether that person is breathing or not by keeping your ear near their nose or mouth. Then you keep your cheek near their nose and mouth and feel their air of breathing. With that we can find out whether that person is breathing or not. And last one is circulation. We have to check whether that person's blood circulation is normal by checking the pulse, and further action should be carried out. We are going to see what are the common injuries that happen or the common causes which need first aid. First one, the first topic is fainting. Fainting is lack of consciousness, and it usually happens due to head injury, epilepsy, stroke, poisoning, diabetes, and mostly due to the lack of oxygen. So further we are going to see the do's and don'ts of what to do during a person is unconscious. So what are the don'ts? First, we shouldn't make that person to eat or drink who is unconscious. Secondly, when that person is starting to gain conscious, we should not immediately make that person to sit up. We have to completely see whether the person or the patient is conscious, and then we have to do the further procedure. Next, the last is we should see whether that person would be able to stand up and go on his own, or we have to assist him to take him to the hospital. Next, we are going to see what are the things which we should do when a person is unconscious. First, when we see a person who is falling unconscious, we have to prevent him or her from falling down and causing further injuries. Secondly, we have to check if the area is quite like oxygenated, as in the crowd is not there, so that the person doesn't feel any warmth, or the person gets plenty of oxygen. Third one is we have to loosen up any tight clothes like the top button, that is the collar button, then ties, etc. Then further we have to place that person in a particular position. First we have to take that particular person's hand and keep it in right angle 90 degree. Then we have to tilt his hand, and so that it forms a pillow again, we have to place that person in his hand pillow, and we have to elevate his or her leg to a few degrees, so that it will help the person's blood to reach the brain, so that lots of oxygen reaches the person's brain, and it helps in the person regaining the consciousness. Next we are going to see is bleeding. Whenever there is an accident, the first main thing which we see is bleeding. So it is very important that we learn the first aid regarding bleeding. Bleeding. What we are going to see in this is whether an accidental injury happens, there will be some sort of bleeding. If it's minor cuts and scrapes, that you can do with disinfecting the area and bandaging with a clean cloth. But if the wound is deeper and if the bleeding is very high, it can be life-threatening. So in such things, we have to apply pressure to the wounded area by using a clean cloth, so that the infection doesn't pass through the wound to the patient. Then if an object is inserted in the wounded area, we shouldn't touch that object or try to pull it out. We have to apply pressure on the side areas and take that person to the hospital for further medical procedure. Then next topic we are going to see is burns. Burns usually occur due to hot temperature, that is sunlight burns, or maybe due to some chemical, then hot flames, fire. There are 3 degrees of burns depending on the depth in which the area is burnt. First degree, second degree and third degree. First degree means the outer layer skin becomes reddish and swollen. This usually is due to dry heat. Second degree burn, it happens due to some extreme kind of injuries, like hot steam has passed to your skin, or fire, etc. This happens in the 2 layers of your skin, that is dermis and epidermis. This area may become reddish, swollen, blisters may form, and the blisters may open, and fluid may come seep through the blisters. Third degree burn is total deformation, that is the place becomes brown and charred. The nerves, the cells, the bone, etc., everything becomes damaged. Not only the skin layer, it affects the bone area also. The bone also melts. That is third degree burn. So how should we treat a person who is subjected to burn? For first degree burn, you have to take that person's hand or limbs or any body part which is affected and cool it down by using water. It is to be noted that we should not apply any water pressure on that area. We have to soak that person's body area which is affected, or we should take any clean cloth and soak it with water and apply it on the area of burn. Secondly, what we should do if the person's burn is like second degree or third degree, we should not remove any kind of clothing which is stuck to that person's burn. If that person's burn is not much, we can either remove the jewelry or the clothing before the swelling start to happen. But we have to be very careful. But while the person's cloth is stuck to the burn, we shouldn't touch it. Further, what we should do is take that person to the hospital for further treatment. Next is about electrocution. Electrocution usually occurs if there is any live wire they are laying down in any area, whether it's your home or a road, etc., or in any other places. So a person should never touch a live wire through naked hands. If that person is touching and the person is electrocuted, the one who is going to do the first aid shouldn't touch the person, because that person can also get electrocuted. So what we should do during this process is, we should take a non-passable object, as in the electricity should not pass through that object, such as wood, etc. We have to take it and we have to shake away that person from that live wire or any objects through which that person is electrocuted. Signs and symptoms of electrocution we are going to see. First, we have to see whether that person has any kind of burn or injury due to electrocution, and we have to dress that particular area. Then we have to check whether the person is breathing or not. That is the most important thing. And if that person is not breathing, we have to do the further DRABC procedure, CPR procedures, etc., and send that person to hospital for further medical procedure. Next is fracture and sprain. Fracture and sprain are the most common things that have occurred during the accidental injury. During a fracture, the person may have a swelling in that particular area, deformity, etc. There are three types of fracture. First one is closed fracture, that occurs usually due to a impacted force on that particular area. Usually you see some kind of swelling in that area, and there will be difficulty during the movement. Next one is open fracture. Open fracture, the bone protrudes out of that particular area, and usually bleeding occurs through that area in open fracture. Next is open fracture due to missile. This usually occurs due to ammunition in war area to that person. In this, usually the bones are shattered into bits and pieces, and it's stuck inside that person's body in flesh. So in these cases, usually you should take that person to the hospital for further procedure. Next, we should see what are the do's and don'ts that we should do during a first aid for fractured person or a patient. When a fractured person or patient is sighted, first what you should do is see if that person is bleeding. That bleeding should be stopped, and next we have to immobilize that particular area, whatever it is, our legs or hands, etc. How do we immobilize? We immobilize by keeping a padding in that particular area and tie it up, so that that person is restricted to move that particular limb or that particular area. So these are the basic first aid treatments which usually people do on the site of accident or any kind of illness to the casualty. Thank you.